Good afternoon and welcome to the daily COVID briefing here from St. Clair County EMA. Today I'm joined with EMA Director Herb Simmons and the Director of the St. Clair County Health Department, Barb Holt. Barb, thanks for joining us.
You bet. Good afternoon, everyone. We have the stats today for St. Clair County and the state of Illinois. Today, thus far, we have tested 202,537 individuals in St. Clair County. That's an increase of only 813 tests since yesterday, with 169 of those that were positive. So with that lower number of testing, obviously the positivity rate was much higher at 20.8% today. That's just for today's stats. That makes our total number of positive cases 20,204. Again, those are males and females under 1 year of age and on into their 90s. Our total for negative tests is 182,333. Today we have no additional deaths to report. We still stand at 312 deaths in St. Clair County. We have 18,452 folks that have completed the 10-day IDPH required isolation period. Statewide, we have tested 12,985,612 individuals. That's an increase of 3,767 since yesterday. So our total positivity rate for the state is 937,909. Unfortunately, we have several deaths to report for the state, 104 deaths since yesterday due to COVID-related illness, for a total of 15,969 deaths due to COVID-related illness in Illinois. Our sympathies go out to all those family and friends of those individuals. Hospital numbers for St. Clair County hospitals: we have 116 patients hospitalized due to COVID-related illness, and of those 116, 14 are on ventilators. Those numbers are up since yesterday and earlier this week. As well as region-wise, we have 191 individuals hospitalized, with 23 on ventilators in the region. Again, Herb, I think that might be one of our highest numbers on ventilators too.
We're up, region-wise, we're up 10
Up
from
10
yesterday.
overall. Wow.
And up 9 on ventilators since yesterday.
Oh, goodness. Additionally, congregate living centers, we have 4 additional cases at Garden Place in Millstadt. This is the first time they've been reported. They have 4 cases and have had no deaths. Knollwood Retirement Center in Caseyville has 1 additional case for 10 cases and 1 death. Mercy Rehab and Care in Swansea has 4 additional cases for a total of 116 cases and 5 deaths. St. Paul's Home, we have 1 additional case to report for a total of 132 cases and 18 deaths. And Freeburg Care Center, we have 2 additional cases for 51 cases and 1 death. And again, testing tomorrow, Monday, Tuesday, Wednesday, will be at our new St. Clair County Public Services Facility from 8 to 4 tomorrow, Monday, Tuesday, Wednesday. That's at 330 West Main. And then also on Thursday, we will be at the St. Clair County Fairgrounds from 8 to 4 for testing, as well as on Saturday, January 2nd. Wow, it'll be January already. I think I'm glad to get rid of 2020 though, Herb. I'm very glad. Yeah. January 2nd, we'll also be at the fairgrounds from 8 to 4. And 7 days a week, we're at St. Clair County Mall, except for New Year's Day for testing. So there's several sites available for testing, and we'll talk a little bit more about the vaccine and when it's available in just a minute.
Very good. Thanks, Barb. We appreciate that. We'll go into the zip code report that we do every day. 62203 goes up 4 to 497. 62204 goes up 1 to 316. 62205 goes up 4 to 502. 62206 goes up 8 to 977. 62207 goes up 2 to 445. 62208 goes up 14 to 1,150. 62220 goes up 11 to 1,389. 62221 goes up 30 today to 1,940. 62223 goes up 9 to 1,215. 62226 goes up 20 to 2,200. 62232 goes up 3 to 653. 62239 goes up 2 to 309. 62240 goes up 1 to 103. 62243 goes up 5 to 479. 62258 goes up 1 to 733. 62260 goes up 6 to 507. 62264 goes up 1 to 235. 62269 goes up 23 to 2,169. 62285 goes up 3 to 403. And 62289 goes up 3 to 34. As Barb said, our daily county positivity rate took a big jump today, went from 10.2 yesterday up to 20.8. Again, that's reflected by 813 tests, with 169 of them being positive. Our regional positivity rate also went up to 12.0 today from 11.6. And the county 7-day rolling average went up from 9.8 to 11.4. And that's the region came in today, Bond County at 1.3%, Clinton County 11.2, Madison 14.1, Monroe 9.5, Randolph 19.1, St. Clair County came in at 20% today, and Washington was at 31.3. Today, out of those 169 that tested positive, 65 of them, Barb, was over the age of 40.
Exactly. They
So-
historically have been the highest percentage of the population that have been testing positively lately.
And we talked about the hospitals here in the county. We actually, St. Clair County went up 13 overnight and went up 4 more to 14 on ventilators overnight. And in region, as we said, up to 191. So we went up 10 and we went up 9 on ventilators, up to 23. Brian, today is a question and answer day, and you have them.
Yes, we do. Lots of health department questions today, so we'll start there with Barb. Your first question came in, says, my husband and I just received the first of our Shingrix vaccine 10 days ago. We have to wait 2 to 6 months for the next vaccine. What if the COVID vaccine is offered to us during this time? Can you take the COVID shot between the 2 shingles doses, or do you have to complete the shingles vaccine first? How long do you wait between the 2 vaccines? So we should be able to complete Shingrix within 2 months. Thanks for all you do.
Thank you. I'm very glad that you got your Shingrix shot, which is, as we know, is for shingles. What I recommend is contacting your physician, because each individual is different and they have a history of your vaccinations and how you respond to each of those. So check with your private physician on when you should get those, if you should get the COVID vaccine.
Okay. The next person says, my 94-year-old father lives in his own home, not a long-term care facility. Other counties like Monroe have started a waiting list for the COVID vaccine. What is the procedure in St. Clair County?
At this time, our priorities right now are getting the vaccine to the hospitals. Monroe County doesn't have hospitals. We have 4 hospitals, and they're those frontline workers to get that vaccine first, as well as getting the vaccine that should be coming in this week for long-term care facilities as well. So those are priority populations. And then when we move into the senior populations, we're working with St. Clair County, their transportation district, and other senior services programs that will be getting information out to the public, offering rides through different programs, and assisting individuals to getting to the vaccine clinics when we have that vaccine available for that target population.
Well, I think, Board, we need to mention, because we thought that vaccine was going to be in here this week, but we have no control over that. We're kind of at the mercy of when it's going to arrive, and once we get it, we'll let everybody know. So
Absolutely, and a lot of people have asked about different tiers and things, and we'll go over that in a little bit of when is it my turn and when can we get the vaccine. We'll talk about that in just a minute.
Okay. The next person said, how can healthcare providers who are not affiliated with a hospital go about getting vaccinated?
Yes, please call the health department, and you will be in once we get the vaccine to distribute to those priority populations, you will be on our list, and please call the health department. Call 825-44, yes, 825-4434, and ask for Michelle. And she will take all the information for those dentists, doctor's offices, those medical providers, hospices, those that aren't affiliated specifically with hospital, and we'll get you on our list to make sure your company and business and frontline workers are aware of when we have that vaccine available to you. So 825-4434 and ask for Michelle.
Okay, thank you. The next person says, is there any information about the new strain that is now in Canada?
Again, it's early. They're evaluating and researching what this is. This just kind of goes to prove we can't let our guard down. You know, we've been fighting this COVID for a long time, and even though we'll be able to get the first round of vaccine and then 3 weeks or 4 weeks down the road get the second round of vaccine, until we have everyone vaccinated and we're able to say we've conquered COVID, we can't let our guard down. We have to continue to make sure we wear our mask, follow the 3 Ws, do our social distancing, that we can get control of this vaccine. It obviously mutates like the flu vaccine does, or like the flu virus does as well. So we need to continue doing what we do. Even if you get your vaccination, first and second shot, you can still be a carrier, even though you may not get sick, but the virus is in the community and you may spread it to another individual.
Okay. The next person says, why do school children need to be quarantined when exposed to a positive case if they're wearing a mask and not in direct contact? Additionally, they say, how many cases have been directly attributed to school exposure?
Again, to quarantine someone, the definition or the guidance is someone that has been in contact with an individual for 15 minutes or more in a 24-hour span, regardless if you have masks on or not. Again, all masks are kind of different. They do a very good job, but how each individual wears their mask might be a little different. So to err on the side of caution, obviously, and these are CDC guidelines worldwide, and the WHO organization worldwide required or asked people to wear masks to help protect individuals. So again, mask or no mask, within 15 minutes of someone that tested positive, they are required to be quarantined for 14 days. As far as how many specific students in schools, we don't have those numbers because we can't pinpoint that child or that teacher may have picked up COVID from that school, because they're in school, they're out of school, they go home, they go to different facilities where it's much easier to track if we have outbreaks, as we report every day, in congregate living centers, because they don't leave. Those residents stay there 24/7, so those are easier to trace, to say that someone brought it into this facility somehow and then it spreads. So we don't have specific numbers on outbreaks in schools because you can't specifically say that was the source of the problem. You can do things such as if it's everybody on a sports team, those obviously are easier to track because there was one centralized group. But overall, we don't have stats specifically for outbreaks in schools.
Well, Barb, and the bottom line to the contact tracing is how honest that person is with the caller from the health department. And I know from talking to you is that there are some people who are just very vague. They don't want to say where I've been, what I've done. And that just makes the contact tracer's job that much harder in trying to track where these cases are coming from.
Absolutely, and again, we want to reiterate, as Herb said, we need the information. People are afraid that we'll tell on them and say, hey, no one wants to be tagged as the COVID carrier. We're bonded by HIPAA rules. We cannot say who has COVID or who we spoke to. That is totally against HIPAA, and our staff are trained not to release any of that information. So sometimes, it's hard to say, or you feel bad saying, well, I was around, these 3 different people. You don't want to get anybody in trouble. You're not getting anybody in trouble. You are
saving
helping
somebody's
them.
life.
You could be saving someone's life, absolutely. So please be honest with that. And again, we move around a lot, so we might have been at school, we stopped at the grocery store on the way home, and, we dropped something off at somebody's house. So we have several different places that we go to. We're a very mobile society, and we still are. We just have to make sure we follow those 3 W's while we do it.
Very good.
Okay, the next person says, how will individuals over 75 know when they can get vaccinated?
Again, as I said earlier, we're working with a lot of, we're meeting with senior service providers. We'll be providing that information in the newspaper, on media, Facebook, Twitter. We'll be getting it out to anywhere and everywhere on television to make sure individuals know which group we are able to give the vaccine to. And I need to reiterate that when we ask you, it's basically bringing your driver's license or some form of identification. But when we have doctor's orders to give vaccine only to these certain groups, say 1A or 1B, our doctor's note specifically says we need to follow those guidelines. So if somebody is going to be 75 in July, but we're giving the vaccine in February and they're only 74, unfortunately, I cannot give you that vaccine until the next group comes into play. So we have to follow those guidelines very strictly.
Well, and one of the simplest things anybody can do is check with your healthcare provider, with your doctor, because as my understanding, some of those physicians are going to be given those vaccines also. Am I correct?
They can. Again, it depends. Some different facilities will be able to give the vaccine as long as they're properly certified. They have to go through, ensure they're on what we call iCare. It's the statewide tracking system to be able to identify the individual, what type of vaccine they got, how long ago they got it, so we know when they can get their second vaccine. So again, there are several. It won't be just the health department and the hospitals that will be giving out the vaccine. For instance, the CVS and Walgreens are going to be given the vaccinations as soon as they receive the vaccine, and that's expected this week to long-term care facilities, to the staff and to the residents there. I mean, they're very busy, so CVS and Walgreens are getting the vaccine, and they'll come into the different long-term care facilities and vaccinate those groups.
Good.
Okay. The next person says, why aren't flu cases reported?
Flu is not a reportable disease, but we have what we call sentinel sites, sentinel hospitals that keep track of those positive influenza cases. As a general rule, we have an idea, as we talk about the positivity of COVID, we kind of have an idea of the positivity of flu in the community. And knock on wood, so far it's been relatively much better this year than years in the past. And we hope that is due to everyone masking, providing proper hand washing, and getting their flu shot. We hope that's why, let's keep it that way.
And it's not too late to get that flu shot.
And it's not too late to get the flu shot at all. There's several facilities all around the county that are still offering that.
Good.
This kind of goes to your conversation about vaccination groups. This person says, I've heard you speak about vaccination groups 1A and 1B, but I can't seem to find the list of who is in what group. Does a list exist? And if so, can you give us a breakdown of who is in them?
Again, you can find this list on the dph.illinois.gov. That's the state of Illinois website, and look under the vaccination plans. And there's all kinds of information there to be able to break it down, as well as the cdc.gov on their website. But I can break it down rather quickly here. So phase 1A, which we're in now, it's hospitals and those frontline workers, the folks that, the medical providers, the doctors, the nurses, the hospital staff. Those are the individuals that received the vaccination first last week. I guess it'll be 2 weeks ago now that they're distributing it to their staff. And then, as well as we'll be getting that vaccine this week for the long-term care facilities. And then any one that's 75 and older will be in the phase 1B, when the health department is getting the vaccine, and that could be hopefully first part of January. 1B is the emergency first responders, the police, the fire, those other, as we said earlier, those other frontline workers, doctors, nurses, those individuals that work with ill people that are not associated with the hospital, they will be on that list. Public health staff, those individuals will be available in 1B. And then in 1C will be those that are high risk and 65 and older. So that's where we're at. I think one of the questions, to do different groups, yes, that's where we're at. So those are where we're at. So the health department will start vaccinating individuals when we get the vaccine for the 1B group.
Well, and Barb, because of the a limited amount of time and stuff with the vaccine, we've actually seen some of our hospitals be able to move into a second group in order to avoid wasting vaccine. And obviously, we think that's a very important step, that we were able to see some of our police and firemen get their vaccines ahead of time because the hospital wanted to ensure that they were utilizing the max
Absolutely.
amount of that vaccine.
And that is allowable. There are very strict guidelines. This is quite a logistics challenge to be able to provide this vaccine, because once you open it and have the vaccine available in that vial, and the vials originally were said to have 5 doses. These are for the Pfizer ones. 5 doses. Some can get 6 or 7 doses out of it, and that's perfectly fine. So we had more than what we thought. So the hospitals had scheduled for their staff to be there at such and such time to get their vaccine. Well, they had more than they needed. But once you open that vial, you only have 2 to 5 hours to be able to get that vaccine. Well, they gave those individuals, I've got extra vaccine. You don't want to waste it. So whoever was available, those first responders, again, those individuals that were in 1B were able to get it. We don't want to waste it. Get it into the arms of those essential workers.
And Barb, we talked earlier before we went on the air that hopefully in the near future, we'll have some numbers that we may be able to share on how many individuals have been vaccinated in the county.
Absolutely. We'll start tracking those numbers. I know we have them, but we'll start reporting those numbers as we move forward now.
Very good.
The next person says, is it true that the health department told firefighters who were positive COVID-19 and still on quarantine that they could respond to calls as long as they did not come in contact with others and they stayed in their vehicle?
That is not correct. If you were positive for COVID, you were isolated and you could not. The positive are the isolated ones, and they are isolated for 10 days. Quarantined ones who may have been in contact with an individual that was positive, if they didn't have enough staff to work that fire shift or had a fire and they're an essential worker that was quarantined, then they may go out, as long as they had no symptoms, they may go out and help fight those fires because they're essential workers and they got to be out there. So the difference is, if you're positive, you're isolated, and you cannot be out there fighting fires. If you're quarantined because you've been in contact with an individual and you have no symptoms, then you're able, only as an essential worker, i.e. fire, police, those types of folks, then you may be able to go out and help when necessary.
Well, that might be where the discrepancy came in there when they say that somebody from the health department told them that. They may have misunderstood it and thought that they were under a quarantine and not isolation. So
Yeah, if you're positive, you're under
clarified.
isolation.
Very good.
Quarantine, you've been in contact.
Okay.
Thank you.
Next person says, do we know when we can return to phase 5?
Wow.
I guess that wouldn't be return though. That would be when we can move to phase 5.
Move to phase 5. We've been fighting this, as we all know, for 289 days. And there is a light at the end of the tunnel. But according to the resurgence plan, we're looking at phase 5 when we're almost back to normal, that we have a vaccine available to everyone that would like to get to it, that we have COVID under control, that it's still not a pandemic and spreading everywhere with our community. You know, we hope that that we're able to get everyone that wants a vaccine by summer out to all those different groups. And some folks, I mean, we've done different surveys. Some folks may want to get it now. Some folks may want to wait and decide further down the road. So again, as we get through these groups, we'll have vaccines available. So it's a tough question. It's a very good question, but again, we're fighting a good fight here, and we're getting there. We're starting to see the light at the end of the tunnel.
I think what is prompted that, under the resurgent plan, as you said, there was the phases. IDPH and them had said that when the vaccine had got here, but their common sense has to go a long way here.
It's got to get in the arms.
It's got to get in the arms.
It's gotta
It's
get
just
in the
not
arms.
being there.
Dr. Ezike made a point to discuss that on one of the briefings last week, that there's a difference between vaccination being available and people being vaccinated.
Right.
And it takes time for that vaccination to occur.
Right. And as you said, the logistics of this has been a nightmare. And, the other day somebody said, well, why haven't you been planning? Well, I hate to tell these people, it's been planning 24 hours a day, 7 days a week, 289 days now that this has been planning. And, if you stop and think about it, we weren't expecting the vaccine this quick.
Yes,
And
that's true.
then all of a sudden, it gets there. It's going to be here in a couple of weeks, and so everything had to start coming together. And the health departments have done a great job. But the people that are watching this briefing, just be patient because everybody's been working around the clock.
Absolutely,
else,
and just like we did when we started the COVID testing, the labs were getting overwhelmed. It took longer to get the testing out, and we worked through the bugs, the state and the labs, and hired private companies to be able to do the testing. Same with this. I mean, they put it in phases because we won't get all the vaccine we need for everyone in St. Clair County. The population 270,000.
And even if you got it all, you have to have the staff to take care of and get it out there and do it. So it's a logistic nightmare.
Absolutely, yes.
Yeah.
The next person says, since the beginning of the pandemic, people 70 years of age, as well as people with underlying serious health conditions regardless of age, have been told they were extremely vulnerable. Apparently, the CDC no longer believes that these individuals, as they've placed them in Tier 1C. The governors of Florida and Texas disagreed with the CDC and moved these citizens to 1B. What is going to happen here in Illinois?
Again, CDC issues these guidelines, and again, they're per ACIP recommendations of those highly vulnerable, and they measure it out by need, and again, target populations. That is why long-term care facilities are in 1A. That is why folks that are 75 and over are in 1B, as well as the firefighters and the police departments. So the adults that have high risk are in 1C, 65 and over. But as we said earlier, we're getting the vaccine faster. We have more vaccine in the specific vials than we thought we would, so we hope we can get to these populations as soon as we can. Again, we can't give it to everybody at the same time. And the other thing to remember, they're 2 doses.
Yes.
So when you get the first dose, and let's say we vaccinate 1,000 people the first week, depending on if it's Pfizer or if Moderna, we need to have 1,000 doses for their second shot that round. So one, we need the vaccine and the staff to give that second dose, as well as, trying to logistically again, as soon as we get the vaccine in, we are closing down our testing site at 330 West Main, and it's all hands on deck, and it's going to be a vaccine clinic. And again, we're following these guidelines to make sure we're getting those populations as quickly as we can, but then we have to make sure we get them their second dose.
Right.
So it's
Because one's not good without the other.
exactly, and you're only going to get 50% efficacy with first. So make sure that make your decision, make an informed decision whether or not to get the vaccine, and as well as ensuring that you get the second round. So we're going to do everything we can. When you get vaccinated, you'll get a card that says what type of vaccine you received and the date you received it, and it'll tell you you should get your next shot by such and such date, depending on what kind it is. Again, when we'll have our clinics, we will let you know which vaccine it is and which groups we're able to give that vaccine to.
The next one, you guys kind of hit this already. They asked, do we know how many vaccines have been administered? And you said that's something you're going to begin adding to the report as quickly as possible.
We will.
And then the last question for the health department today says, if hospitals are just as high as infection spreading as restaurants, why hasn't unnecessary surgeries and doctor's visits been shut down?
Well, again, hospitals are essential life-saving services. I mean, we have to have them open. A lot of doctors' offices have gone to virtual meetings with their clients, with their patients. For the surgeries, the individual, the patient, is being required to have a COVID test before they even come in the door, before they can have surgery. So again, and hospital personnel wear PPE. They follow sanitary precautions with the gloves, the gowns, the mask, and all what they do. So they are at a much higher level. Plus, we need them. Yes. They have to be open to save our lives. You know, if I have a broken leg, I need a hospital. That needs to be taken care of. But again, they do a lot more testing and pre-screening and so forth, rather than a restaurant even possibly could.
I mean, a friend of ours last night had to go to the emergency room and get a cut on his foot taken care of. Mm-hmm. So it's just they're not just there waiting to take care of COVID patients. They're taking care of those type of injuries and the illnesses. And so that's why we keep talking about we have to make sure our hospitals don't get overloaded. And
absolutely.
And then we have to have the staff to help take care of those patients in the bed.
Okay. Director Simmons, first question here for you today.
You can answer that one.
Why don't the zip code numbers match up with what's reported on the state? And that's something we talk about very frequently.
Yes.
The fact is, zip code numbers are usually 3, 4, 5 days delayed from when the state posts them from when we've actually reported those cases here. So like the cases we report today as new cases in St. Clair County, it's going to be several days before the state gets around to adding those to the zip code report. So definitely a reason why those don't line up there. Next one is, a person starts by saying, thanks for your dedication. I have grandkids going in-person school after Christmas. They wear glasses and they fog up with their masks. Have you heard of any solution to stop the fogging?
Yes, right here. For those of you, you can go online and get the anti-fog silk cloth. And if you want to call the office here, I'll give you the contact information or send me a message. And it works real good. We've all used it around here. Before we were having the same problems. So give us a call and we'll give you that information. Okay. So that's our question and answers for the day. As we said, our numbers are not what they should be. Of course, after the holiday here, we'll reserve what's going to happen over the next week and a half to 2 weeks. That's where we'll see if everybody behaved themselves. We hope they did. We hope everybody took the warnings and practiced the 3 W's and the social distancing. And if you had to get together, you limited the size of it. But only time will tell. So I'm not going to sit here and beat everybody up over that, because even though our numbers are higher today, we anticipate the roller coaster ride every now and then. But we got to continue, as you heard Barb say. We can't let our guard down. Everybody is working hard. Team St. Clair, you're working hard, sharing the word, sharing these briefings out there to your friends and family. We see more and more people joining in, leaving comments, and we appreciate the support. But we're not out of the woods yet. Like Barb said, the vaccines are here, more is coming. Do your research. We hope everybody takes advantage of it, because that is a step in the right direction. Everybody getting that vaccine and getting those 2 shots, and then we can all get back to some sense of normal. Our businesses and everybody will start feeling a lot better about this whole deal. So we'll be back tomorrow for day 290. Yes, 290 days you've been listening to us. And we're going to be here until it's over with, as we say. So everybody have a good rest of the evening, and we'll see you tomorrow.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year. and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together